Hi everyone, my name is Jenny Rios. I'm a graduate student from the Masters of Science Nutrition at uni. So this is my presentation of the patient. So for this week, I have a female, 19 years old, with a height of 5'4". Her weight is high, it's 91.6 kilograms, which the BMI is considered obese. Based on the percent of her ideal body weight is 168%, and the ideal body weight is 54.5 kilograms. The chief complaint of this patient is psychiatric disorder. Right now, she's on call for 15 days because she was trying to harm her roommate. We don't have any past medical history about this patient. So the primary diagnosis was schizophrenia, and the secondary diagnosis was anxiety and insomnia. And as I mentioned, she doesn't have any past hospital admissions. So checking her labs, the glucose is a little bit higher than the normal. The triglycerides are super high, which is 171. And the ALT, which are the enzymes of the liver, are high too. So the medication that she's taking, it's only two. It's Alpacin, which is an antipsychotic medication, and Ambien, which are short-term treatment of insomnia. She also refused three medication because she was stating that she doesn't have any mental issue. In identifying the nutrition problems that the dietitian is responsible for treating, it's trying to lower the triglycerides and the obesity that she presents. So doing the nutrition assessment, I try to use both calculations using the Mifflin equation, which it gives me 2030 kilocalories per day, or the other one using normal calories for with the adjust body weight, because remember that this patient is 168% higher than the ideal body weight, so the total is 1732 to 2079, so I'm going to use the second one. And the estimate protein intake, I also use the adjust body weight, and she is going to receive 83 to 104 grams per kilogram per day. And the fluids, I considered 30 to 35 because she's really young. So she's going to receive 1,635 to 1,908. So because she's a psych patient, they have like another unit in the hospital. But the little bit that I see her, she doesn't present any weight loss. And by checking the EMR, it mentioned that she's eating everything. So food and nutrient intake, she doesn't present any malnutrition. She doesn't present any lost weight during these days, and she doesn't present any fluid accumulation or edema. My PA's statement is alterate nutrition related laboratory values related to the excessive intake of saturated fats as evidenced by high triglycerides of 171. So the intervention that I suggest is a low cholesterol, low fat diet with a regular texture. The patient doesn't present any swallow or chewing problem. I also ask the nurse if the patient has all the teeth or if she has dentures, which was like a no. And the nutrition monitoring and evaluation is monitor the triglycerides because the triglycerides were super high, and try to weekly weight because psych patient they don't get really frequent in that unit, so I just suggest that because she stayed another weight which were lower than she is now. However, after that they weighed her on a scale, and the weight was the same as the chair scale, because the last weight that they have is on a chair scale. So I just want to monitor that the patient is not losing weight and maybe have like any malnutrition. But with this patient, it's kind of hard to 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 use the state weight. So I just want to make like a weekly weight, and also basing checking all the EMR. It says on the in the nurse report that the patient is taking all her meals. So that be it for this week, and thank you so much.